him. Dr. McWherter received his undergraduate degrees in physics and mathematics in 1973 from the University of Texas at Austin. Upon attending the University of Texas Health Science Center at Dallas, he was awarded a medical degree in 1977 and completed his residency in obstetrics and gynecology in 1981. Dr. McWherter is a fellow of the American College of Obstetricians and Gynecologists. He's a fellow of the American College of Surgeons and holds memberships in the American College for Advancement in Medicine and the Endocrine Society. Dr. McWherter has served as the chairman of the Peer Review Planning Committee and speaker for the Integrative Medicine for Anti-Aging Conference and Exposition. He was awarded the prestigious Alan P. Mintz MD Award for Excellence in Age Management Medicine. He also served as chairman of the Peer Review Planning Committee and speaker for the Integrative Medicine for Anti-Aging Conference and Exposition. Dr. McWherter presently is the medical director of the FEM Center and Energy Health Center offices in Colleyville and Fort Worth, Texas. He has helped thousands of women find optimal health and wellness through hormonal balancing. As an innovator in the fields of women's health and anti-aging, Dr. McWherter believes that a thorough approach to healthcare includes preventive measures that may help avoid diseases such as breast cancer. Dr. McWherter, are you there?
I'm there. Can you hear me?
Yes, I can hear you loud and clear. If you
Good.
can see the screen, you can see we have your handsome face up
I
there,
tell
so
you, I do.
people, so people can feel like they know who they're listening to. Dr. McWherter, what we like, we are so happy that you agreed to come and speak for us, be one of our speakers in March at our first annual Functional Medicine Conference in Atlanta, March 6th through the 9th. And what we would like is for you to give us just to whet our appetite about what you're going to be speaking about. We know you've put a lot of time and effort and clinical hours in what you do. But if you could give us 5-10 minutes of what you're going to be talking about so that it can entice our audience to come hear more.
I love to, Dr. Taylor, and you just keep speaking better. Every time I listen to you, I want to vote for you more and more for public office. I think you ought to run for something. I tell you what. I'll vote for whatever you want. Okay, let's get the government going again. Let's vote for Dr. Taylor. Okay. So anyway,
Okay.
thank you for asking me to speak tonight. It's October, Breast Cancer Awareness Month, so what an appropriate topic for me tonight. This is a great organization. I fully believe in what Dr. Taylor is doing, and tonight I'm going to present just a little preview of what I will be talking about. Uh, as a physicist, I kind of look at things in a much different way than a lot of people, and one of my important things that I like to look at is, of course, the relationship of breast and hormonal therapy, because my specialty is using hormonal therapy. I have 1,700 breast cancer survivors. The majority of those I actually use estrogen in. And I can't hear any gasp out there, but I'm sure there may be some out there. And if there's an oncologist, just cover your ears. But I have a different perspective of breast cancer. My paradigm is, as I'll explain in detail in our lecture, is that our current system says all diseases arise from cell dysfunction. So you take a new to nature molecule, you try to block one pathway, and we see this has been a dismal failure because 43 years ago we declared war on cancer, and at this point in time, I don't think we're winning. I think it's a stalemate. What I believe in is that it's the extracellular matrix which surrounds the breast cell that's the key to the origination, progression, invasiveness, and metastasis for breast cancer. So the cell really means nothing to me. If you get to thinking about it, our cells are all meant to divide. If our cells didn't want to divide, then we would be a 2 or 3 cell organism in some slime pit in the outside where they have water collecting. We would have evolved into a multi-organ organism. So to me, it's this glue that holds our cells together that really determines what turns into a malignancy. You can extrapolate this actually to all parts of aging, even to the preservation of telomeres. So to me, I guess it's what Pasteur said that was purported to say on his deathbed: the cell is nothing, the matrix is everything. And I've taken this paradigm shift and I've constructed some nutraceutical orthomolecular agents that I've shown to be very effective on the breast that I will share these with you in March, and I will tell you how you can evaluate the breast to know where to use these different agents. And again, you can go back to your practices after this talk and construct what I call a breast protective program. But again, we're not going to be looking at cells. We're going to be looking at, again, the matrix, the gatekeeper of the cell. It's that nurturing glue that's around every cell. It controls the cell metabolism, the biological activity, the defense mechanism, and even communicates with the inside of the cell. Now, the extracellular matrix is very susceptible to what we call chronic inflammation. So it's chronic inflammation which breaks down the extracellular matrix that allows the breast cell to divide uncontrollably, and this will turn into a tumor. So this is the premise for my talk. And this is the premise for actually some of the things that I have designed to keep the matrix stabilized, and I will show you on mastectomy specimens and various other modalities how I've achieved this. We're seeing now a little tug of war in the hormonal world, and I think Dr. Taylor is quite aware of this as an obstetrician gynecologist. We have the number crunchers on one side who set up the horrible WHI study, which was poorly designed, and they're saying that all hormones are bad. You know, they don't prevent chronic disease, or they're bad for you. Then you have the clinicians, such as Dr. Taylor, myself, and you out in the audience, who say, no, wait a minute. It's a balance of things. You just can't write a prescription for one thing and send them home for a year. You've got to make sure that the system is alkalinized, that you've modified their lifestyle habits. But I will show you how stabilizing the matrix is the key element in safeguarding the breast in terms of even taking hormones. So we'll talk at some point on how to stabilize the matrix at the cellular level. We want to decrease tissue inflammation. Remember, inflammation provokes angiogenesis and vasculogenesis. Vasculogenesis is a recruitment of the endothelial cells, or the endothelial cells, to make new cells, whereas angiogenesis is a sprouting of cells. I'll show you how one can stabilize and make a chemoprotective agent where if you do have an occult cancer, at least let's go ahead and encapsulate it, render it dormant, and that way it won't spread before detection. One of the things that we're seeing now is breast density is a big issue out there, and if you're not aware of this, in a postmenopausal woman, dense breast carries about a 6-fold increased risk of breast cancer. To me, it's the #1 risk factor for breast cancer when you look at it. Breast density is really an abnormality of the extracellular matrix. And what happens is there are really no treatments out there right now. Tamoxifen is a very poor choice, in my opinion. That's the only thing that I've seen listed. And I'm going to offer you some take-home messages where you can start treating those right away and help with reduction of the matrix density. I'll show you some diagnostic techniques that let you see through dense breast. Remember, the mammogram detects 98% of breast cancers in women with fatty breasts. Only 48% women will have their mammogram detect breast cancer in dense breast. Now, I had a lady who had a 6-centimeter breast tumor that was missed for 3 years with an MRI and 3 diagnostic mammograms. So, you know, there is a society called Are You Dense? And there are laws and various legislatures that require the radiologist to report to women that they have dense breasts. The real issue here is that these radiologists don't want to report it because they don't know what to do next. And the physicians who get the report saying that these women have dense breasts, what are they to do? They have nothing to offer these women. So I'm going to outline a program that, again, will help address one of the top issues that I see right now, and that's called increased breast density. And we'll use various elements that you may or may not be familiar with. But remember, the talk that I give in March is just, if you don't have the equipment, it's just to familiarize you with the fact that it is out there. As I was going through some of my interesting notes today, I found some relative risk factors that we see for breast cancer. I didn't realize, you know, when you look at Primprol, the relative risk for breast cancer is about 1.24%. If you look at the relative risk for a flight attendant, it's 1.87%. If you're obese, the relative risk for breast cancer is 3.3. So my feeling is, you know, knowing the facts, having a treatment plan based on what the real issues are, and then having a diagnostic modality to confirm your success for the breast is the key. And again, women are searching for those practitioners who have answers, and you want evidence-based medicine behind you. I will show you how I've used in vivo and in vitro studies to confirm everything that I have developed for the breast. And again, this provides the backing that we now see, which the FDA and all these other organizations are looking at. So, I am excited that we had the opportunity to meet in March together. I want to be sure, and the stuff that we'll be talking about are orthomolecular or nutraceutical agents that everybody's familiar with. I might delve into some other things like the hedgehog signaling pathway, which operates on a very interesting system that we can control even with nutraceuticals. We'll go over some fine details. And again, when we talk about prevention, we talk about chemoprevention, chemoprotection, and right now there is no funding for what you and I propose to do. I was looking here at the Komen net revenue. Out of a $300 million revenue, only 3% of that research is funded for prevention. So, it has to start in our offices. So I'll be showing you then how to protect the breast using what we call the extracellular matrix stabilization principles. I'll show you clinical trials, something that you can use that has minimal side effects, but it is capable of inhibiting multiple chronic inflammatory pathways, an adaptogenic agent that's synergistic and multi-purpose. And you're going to be able to use this on your patients. You're going to understand further modalities in the future that you might want to acquire to help you evaluate the breast. Mammography is the gold standard, but it is not the ultimate standard. And it's not that I would say we do away with mammography, but I have a very interesting way of how you can incorporate the interpretation of mammography with certain tools that we have available. So, Dr. Taylor, I'm looking forward to our March meeting, and I promise to have some pretty interesting information there for you.
Well, Dr. McWherter, I can guarantee everybody who's listening that you're going to hear some information that you've never heard before. It's going to make perfect sense to you, but it just like everything in functional medicine, it requires you to kind of erase the things that you think you know and open your brain up and listen to this. And as he's saying, women are looking for other answers. They're looking for things other than mammographies and tamoxifen for 5 years, and then they say, okay, good luck. That's pretty much the what they're sent home with is good luck, and we'll cross our fingers and hope it doesn't come back. Um, so what he is talking about is a whole different way to look at it. And controlling inflammation also gives that, don't you think it gives that patient some sense of control, that there are some things that they can do to, uh,
Yes.
help prevent this recurrence? Because that's what everyone is deathly afraid of, that is going to come back.
Yes. In fact, a lot of what I've talked about can be applied not only to the breast, but to osteoarthritis, things such as this. So it gives the patient at least it makes them feel a part of the program. They
Right.
understand inflammation because that's kind of even on the advertisement range. Now you hear
Hmm.
about things, but they hear about drugs that stop inflammation.
Right.
So when we apply when you start saying the breast has the same inflammatory molecules that cause breast cancer as that which causes joint pain or Alzheimer's, the patients then understand that this is a unified approach, and it makes a lot of sense to them that they're not having to do 10 different things for 10 different organ systems.
Yes. I want to open it up. If you can, I just want to open it up for questions. If Dr. McWherter, if you don't mind, we'll see if there's anybody
Oh,
who
no problem.
has a couple of questions. We don't want to give it all away, but this is, I think it's so thought-provoking and intriguing that some people may have some questions. If you have a question, there's a little box over there by your name over there on the dashboard that has a hand. And if you click that, it's like raising your hand in a classroom. And if you raise your hand, I will unmute you and you can ask your question. Can you just talk about how you use, just real quickly, how you use thermography? You probably have more experience with thermography than just about any physician I know. Can you just give us a little history about how you use thermography in your practice?
Yes, and it's interesting. I've even changed it since I've talked to you last. Using my orthomolecular transdermal, I figured out how to finally read thermograms. It's taken me about 13 years, but I wasn't reading them right. I'm going to
Hmm.
kind of go over that in March on how we can use the thermogram as an infrared imaging tool for the vascularity of the breast. In fact, I have two radiology groups now that work with me and aligning mammograms and thermograms. And I'm telling you, I don't want to tell you I'm 100%, but I don't miss lesions. Now, I'm not diagnosing things. All I'm
Right.
saying is I look at the vascularity. Remember, you cannot have a cancer in your breast unless you have a blood vessel to supply it. I've
Hmm.
identified the anatomy that gives rise to suspicions for breast tumors. So I'm going to go with that very carefully. But don't read thermograms the way you were taught to in the old ways, because that's not going to help you. I will outline a different way that anatomically makes a lot of sense and will kind of amplify what you see on the mammogram, and that really helps the patient. It's one of the best things I've done.
Okay. All right. So that's great. So you have a different way of looking at thermography. So I can't wait to hear it, Dr. McWherter. I'm going to ask again. Let me see if there's any questions. I hope people know how to raise a hand. Let me see. Hold on. Here we go. Dr.
I'm
Hams.
sure, Dr. Taylor. I'm sure, Dr. Taylor, you've seen that article by Sorrell about how all this wrong information has cost about 50,000 women their lives.
I'm sure. I'm sure. You know, it is. It's just. It's bad. Again, that they have these set rules. Everybody, they get the
It is.
radiation, the chemo, the lumpectomy, the tamoxifen, and then it's okay. I hope you have a good life, and we'll keep watching when it comes back. We'll just do it all over again, and the patient is just left there, leaves there scared to death, and not being able to really live their lives. So we had one. Dr. Hams, you had a question?
Yes.
Hmm.
What do you tell women as far as who have breast cancer as far as drinking alcohol and eating red meat as far as prevention or problems with breast cancer?
As a purist, I would say red meat, of course, is acidotic. Red meat, of course, I mean, and that's the cut of red meat we're talking about. Let's presume that it's not the lean, grass-fed meat, and but it can contain chemicals. It's acidotic. Most of the women that I talk to now, I live in Texas, and remember, a lot of cattle are raised in Texas. Okay, so I got to be careful what I say because I do take care of these women whose husbands are ranchers, and I don't want to end up on a flagpole upside down. Okay, so I would say probably steer away from red meat as much as possible. But I would say what's worse is having your blood sugar drop or hypoglycemia. To me, the thing that turns on inflammation that will destroy things and have a cancer cell wake up is hypoglycemia. So I might rather you have a very high quality piece of red meat than go out and eat a bagel. Okay. Now, again, though, you shouldn't. I would say minimize that to less than 3 times a week if you can. Um, if you said no red meat, I could understand that in your program too. But I think I recommend more of a paleo diet, a Budwig type diet. It's a combination between Budwig and paleo diet for the breast cancer patients. As far as alcohol, you know, here's how I look at alcohol. It's empty calories. It's sugar. Again, it can induce hypoglycemia. However, I live in the world of reality. Okay, and you can't tell people to be perfect all the time, or they may not do anything you want any of the time. So I would say at least do a Pinot, a good red wine, and if you do it with a high protein source like the French do, like either with supper or with some type of other protein, and when a glass is not, a pitcher, remember, it is truly a glass of red wine. I think that can be done, on occasions. Generally, what I tell people is try to eat right or do what I tell you 5 days a week, and 2 days a week maybe you can enjoy life a little on the lateral side. But again, I deal in the world of reality. Okay.
Thank you.
Okay. Great. Yeah, that's kind of my philosophy because, again, if you tell the patient to do too much, she's not going to do anything. And what she'll do is do the least two important things and not do the one or two important things that you like for them to do. And it is that 80-20 rule seems to always bear out that if you can do the right thing 80% of the time, then you can overcome the 20% when you cheat a little bit.
You know, what I will talk about in March, Dr. Taylor, is the fact that what you can do to the breast tissue the matrix doesn't suffer that bad from what we were just talking about. Don't think in terms of cells anymore. Don't think in terms of what a cell would do. Think in terms of what the matrix would do. You can stabilize the matrix in a breast so that it doesn't really react as adversely as you might think to some of these things. Now, for metastatic disease, that's a different thing, okay? So for non-metastatic breast cancer that has negative nodes, I kind of make it very easy to follow things. But again, it's protecting that breast cell matrix. That's the paradigm we will talk about in March.
Okay. All right. Dr. McWherter, we thank you for taking some time out of your busy day to talk to us on our webinar. We are so looking forward to having you in March, and we have this recorded. We'll be sending it out, and uh, again, we just want to thank you. And you don't have to stay. We're going to talk about some other things, but again, we appreciate it. And let me make sure there's no other questions. Okay, Dr. McWherter, and we'll continue to stay in touch with you between now and March. And thanks again for your time. So go eat dinner. I know it's 7:30 there, so go eat your once a week steak from one of your rancher patients.
With a glass of red wine.
Yeah,
Let's
exactly.
get out of the way today, and we'll be good for the rest. Thank you, Dr. Taylor, so much.